Okay, this is my patient, 27-year-old male. I am first going to assess your level of consciousness. Please tell me where you are, what time it is, and what's your name.
My name is Jacob Poole. I'm at my house in Bryant, Arkansas, and it's 9:25 p.m.
Okay. Please, do you remember who your first grade teacher was?
Miss Green.
Okay, and what did you eat for breakfast this morning?
Oatmeal.
Okay, that was assessing your remote and recent memory. First, we are going to assess your cranial nerve 1, which is olfactory. I'm going to let you smell something, if you would close your eyes. I'm going to let you smell something and you tell me what it is, okay?
Smells like a candy or like a peppermint.
Okay, yep, that's right. Okay, now I'm going to assess, yep, that's it. I'm going to assess your optic nerve, and this is for your vision. I'm going to get you to read my badge from about 12 feet away.
Team ACH, Haley, and then it says Haley Poole, RN1, 4E/4H, cardiovascular, and it says ICU. It says ACH team member in green.
Okay.
And the purple said RN.
Good job. Okay, now I'm going to assess oculomotor, which is pupillary constriction. And just look straight ahead, and I'm going to run the pen light. Okay. Alright, his pupils are equal and reactive to light. Now I'm going to assess your trochlear and your abducens, which is lateral and internal deviation of your eye. If you would, just follow this pen light, those 6 cardinal signs of vision, okay? Okay, now follow this pen. I'm going to touch your nose, just follow it with your eyes. Okay? You don't have any abnormal signs of your eye, no drooping of your eyelid, anything in that nature. Now I'm going to assess cranial nerve 5, which is the trigeminal nerve. And if you would, clench your jaw, and I'm just going to feel your muscle tone. Okay, now move your jaw side to side. Okay, that's good. And now I'm going to assess your facial. You have an appropriate expression on your face. Can you raise your eyebrows? Okay. Now close your eyes as tight as you can and don't allow me to open them. Okay, can't open them. Now if you would, let me see the top and the bottom of your teeth. Okay? Awesome. Now puff out both your cheeks and don't let me push them in. Awesome. Okay, you have good muscle tone now. Now, cranial nerve 8, which is acoustic, is hearing. I'm going to whisper 3 words back here, about 3 feet away, and you tell me what I'm saying, okay? With your eyes closed.
Talk farm tree.
Okay, good.
Right.
Yes, that was right. And if I had a tuning fork, I would perform the Ryan test and the Weber test. The Ryan test tests for air and bone conduction, and the Weber test tests for lateral injection. The Weber test is performed above the head with a ding, and I would ask the patient if they heard the vibration. And turn towards the camera a little bit. The Ryan test is back here on the mastoid bone, and I would do it until they didn't hear the vibration anymore. So, but I don't have a tuning fork, so we can't do that. Now I'm going to assess your glossopharyngeal cranial nerve. If you would, open your mouth, look up for me real quick, and say ah. Okay. Your soft palate is fine. Your pharynx and your uvula is in line. Now I'm going to get you to taste something, and you tell me what it is. Close your eyes.
What?
I'm going to get you to taste something, and close your eyes.
That's that same peppermint I smelled earlier.
Peppermint? Yes, that's right. Okay, now I'm going to assess your vagus nerve, which I already did with your glossopharyngeal nerve, which is with the pen light and your uvula. Now your hypoglossal nerve, which is cranial nerve 12, is your tongue. So if you would stick your tongue straight out.
Oh.
Okay. Alright, if he has no deviation of his tongue, it's fine. It doesn't move any other way. Okay, for cranial nerve 11 is spinal accessory nerve. Shrug your shoulders and don't let me push them down. Okay, can't push them down. Now I'm done with your cranial nerves. I'm going to assess your deep tendon reflexes. So if you can sit up here, I'm going to assess your patellar reflex first. I have to use this little hammer. Okay, now I'm going to move the camera down a little bit. This is patellar reflex. I'm going to hit it and you should have a reflex. It's about an inch below the knee, right between this bone and the patella. Okay, good deal. Now I'm going to assess the brachioradialis reflex. If you would just rest your hand in your lap, you can sit down. Just like this, a little bit of supination, pronation, and I'm going to brachioradialis is about right here. You should have just a little reflex of your forearm whenever I sit right here. Just a tiny movement. Okay. Alright. His reflexes are 2+ and intact. Now I'm going to get you to walk from the door to the chair. I'm going to assess your gait. Want to stand it up. Okay, good deal. Now, if you would go back just a little bit so the camera can see you. If you would stand on one foot, let's see, check your balance. Okay, can you do it on the other foot? Okay, you have good balance. And now I'm going to assess your coordination and your rapid movement. Okay, with this pen, touch this pen wherever I move it, okay? And then take your hand back every time you touch it.
Okay.
Alright, good. Okay. Now, if you would get your fingers and do 1, 2, 3, 4, 1, 2, 3, 4. Can you do one hand at a time? Okay. Good job. Okay, now I'm going to assess your pain. I'm going to hit you with something sharp and something dull, and you let me know what it is. Close your eyes.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, you're wrong on one, but the other ones you're right. So good job. Now I'm going to assess your temperature. Close your eyes again. I'm going to get you to feel 2 different things, and you tell me if they're hot or cold. Don't look. Okay. So raise.
Cold. Cold. Hot.
Good job. You didn't miss those. Now I'm going to assess your light touch. I'm going to put this cotton ball somewhere on your body, and you tell me whenever you feel it. Just raise your arm when you raise your arm up real high so the camera can see whenever you feel it. Or you can say that I'm touching it.
Feel it. Feel it. Feel it. Feel it.
Awesome. You didn't miss any of those. Alright.
Okay,
Thank you for your time.